Would Botox help if just one eye needs a lift? I have hooded eyes, but one is worse than the other. Sometimes I really feel the droop, and it's extremely visual in pictures. Would Botox on just the bad eye work?
Thank you for your question. You've submitted photos of your eyes and you are asking, can Botox help one eyelid in terms of hooding because one eyelid has more hooding compared to the other? Well, I can certainly share with you my thoughts on your photos and how I counsel my patients about the different strategies to help hooded eyes. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been treating patients with Botox since 1993, and I also perform a lot of cosmetic surgery for hooded upper eyelids. So it's very important when I meet a patient like yourself who comes with very similar types of concerns to help guide them on what is the potential benefit and what are the limits. So to begin with, when I look at a person like yourself, I can see that there is a difference in the facial volume between the two eye sockets or a skeletal structure, and that's perfectly normal. The human body is naturally asymmetric, and so the right side, the brow, is a little bit lower, the left side, the brow, is a little bit higher, and it appears that the right eye, the hooding, is greater than the left. So there are certainly ways to try to enhance the balance, and you can begin with first understanding how does Botox actually lift eyebrows. Botox is a neurotoxin. Botox, Dysport, Xeomin are all neurotoxins, different types of botulinum toxin. And what they do is relax certain muscles strategically so that unopposed action of other muscles can occur. So, at least in the principle as it applies to brow lifting. So, when you think of the eyebrow position, there is a brow elevator called the frontalis muscle, and then there's a brow depressor set of muscles. And those muscles are the corrugator procerus muscle and the orbicularis oculi muscle. So, you can strategically inject the brow depressors to get the eyebrow to lift. Now the question is can that eyebrow lift enough to make an impact on your upper eyelid hooding? Well, an argument for trying it is that Botox is fairly safe. It works for a temporary period of time, average about 4 months, and you can see if you get a little bit of elevation. If, however, the amount of hooding in your upper eyelid is so significant that even with Botox, it doesn't go, the eyelid doesn't come up, or the eyebrow doesn't come up enough to open up the eyelid, then you may want to consider upper eyelid blepharoplasty. Now, a lot of people who are afraid of surgery will not even entertain the idea because when they think of surgery, they think of general anesthesia. In our practice, we have overcome that obstacle decades ago by developing systems and processes to do the procedures under local anesthesia. And it's very important to also help people deal with any types of anxiety and anticipation, so we also give very light sedation. So that combination has been very successful. Another fear that patients will have is about being overdone. Thanks to certain actors and certain people in media, people are very afraid of looking surprised. And so that's where we talk about the art of the procedure. And even though I'm further developing the idea about hooding, it's just important to at least understand your options, because my general perception from looking at your photo is that Botox will not likely be enough. Going back to the original point about the surgery, Basically, when I do my procedures, before I do them, I actually sit with the patient and I do the drawings and planning with the patient. So they understand and we decide together, are we going to be conservative? Are we going to be, or are we going to be more aggressive? And what are the desired outcomes? And the patients understand exactly what I'm going to do. I draw on them, we take photos, we have them sign the photos so that we know that we're all working with the same map, and then we proceed with the surgery. I'm mentioning that because, again, this is, as is often the case for many patients who come to me for cosmetic eyelid surgery, is that they often will try a lot of non-invasive things before they end up having eyelid surgery. And what I have perceived in modern times is that a lot of people are over-promising non-invasive procedures that don't come close to achieving what is accomplished by eyelid surgery. Doesn't stop them from trying. People try different heating devices. People try different types of lifting threads of various kinds. And ultimately, if there's extra skin, there's no getting around it. There's extra skin. But there is always a role for a combination approach. But as far as the question that you're asking is concerned, you can selectively reduce the activity of the depressor muscles on the on the side where the brow is lower, and see if that brow comes up enough to give you at least better symmetry. You might find it a little bit estranged because the muscles on the other side are going to be working differently, but that is not always an issue, and it's certainly, like I said, it's worthwhile trying because it is a drug that goes away. So if it doesn't work, or you just don't like the way it affects you, well, you just wait a few months and it's gone. So learn, of course, about the option of the Botox brow lift approach, as well as explore further the idea of limited cosmetic upper eyelid blepharoplasty under local anesthesia with light sedation. I did mention to you that also procedures are done in our office under local anesthesia light sedation in our Joint Commission approved facility. So for many patients who have another hesitation about surgery, is they don't want to go to a hospital or to a major surgery center where they may feel like they're going to be treated like cattle. And so when in an office setting, it's a lot more private and a lot more, you know the staff members. But to maintain the same level of safety as a hospital surgery center, we are certified by the Joint Commission, and we go through processes and protocols to ensure that there's no difference between how a patient is treated in our office facility compared to a typical ambulatory surgery facility. So I hope that was helpful. I wish you the best of luck, and thank you for your question.